I'm starting it now. So welcome everybody, and I want to welcome Andrea Crook and Dawniell Zavala back. Andrea is the Director of Advocacy for Access California. It's a statewide consumer-led public mental health advocacy program of Cal Voices. And Dawniell Zavala is the General Counsel and Associate Director of Cal Voices, which is an affiliate of Mental Health America. They both have many years of experience working both with employers, but also in placing peer support in places where it hasn't been before. And so it's really exciting for us to be able to talk about these things. So today we're going to talk about peer support for peer specialists when they go into these new environments. And then we're also going to talk about once they're there and once you've gone through this whole process of introducing, preparing the existing staff, designing the programs for success, and once service delivery begins, what are some of the kind of natural headaches that you might encounter, and how does it generally go in the flow? I mean, every one of these is different. I've worked on some projects like this myself, and no two are the same. But maybe Andrea, you might want to start out. So when people are coming into these positions, how important is it to provide support for them, specifically for the peer employees?
I think that's a really great question. I was first going to say hi, Patrick, but because I don't know how these are being, rolled out, but it's really been great to be able to do these with you. It's been a lot of fun. But obviously, I feel that peer support for peer employees is incredibly important, but I also think it's important for all employees. So I feel like one of the takeaways I want folks to kind of keep in mind as we move forward is that, a lot of this is about the human experience. And I feel that as peer employees, it's difficult because you're taking an experience that you've had that was probably the most devastating, life-changing, shameful, stigmatizing experiences, and now turning it into a positive, right, to help others. But again, they're still on that recovery journey. So it's hard work. So we want to ensure that we are providing and creating spaces for ongoing peer support and just supportive employment, so that we're keeping ourselves well and able to support others as well.
In our other discussions, we've talked a lot about like how you prepare the employer and the existing staff and all that. But one thing we didn't really talk much about is how much work do you have to do with the peers when you're getting them ready to go into, say, an environment, that's very clinical or something where they've never worked before in that environment. And maybe they're even the first peers to come into an environment like that. How much work do you do with the peers, and what kind of work would that be?
Well, I think that's a really good question. And again, I think that goes back to all of the work that the individual has to do for themselves in order to be ready for that type of position. Because again, when we're hiring individuals, when we're hiring peers, they've already done the internal work on their road to recovery. But as I believe Dawniell had a great example about how she, with one of our new programs, her psychiatrist happened to be part of the team that was preparing and gearing up for peers to come on board. And I think that that's something that we need to be mindful of, and we need to ensure that we are that the individuals are aware of the teams that they're going to be working with, and that first that they are comfortable being in that environment. And I would say for the most part, the peers that we hire, they all have lived experience with the settings they're employed.
Okay.
So if an individual is providing services in an outpatient clinic, they've received services in an outpatient clinic or inpatient and so on. So
Right,
they already know what to expect because they were once a service recipient.
right.
I think that where the rub is if they're going into work in a facility where they once received services, and if they had a positive, whether it was positive or negative, but especially if it was negative, those are things that we need to keep in mind and ensure that we're creating a safe and supportive environment.
What are some of the best ways that you found to make sure that people going, the peer specialists, feel supported in their own employment? So what is your organization doing to support the people that you place within these other locations?
I can say that for, I'm going to speak with one of our programs, and what we do is we always try to have a senior, like a senior peer provider, um, um, have the opportunity to take the new employee under their wing, and that can be shadowing,
Mhm,
but we'd like to do that with ongoing basis with all of our team members so that they have an opportunity to learn from them, and to support each other with their clients, because it's important too for the clients that they get to know all of the peer providers, because sometimes there's shift in staffing. So
mhm,
but in particular, to ensure that we are creating a supportive environment for our peers, we have designated times on a weekly basis for the peers to get together and to check in,
mhm,
and to just kind of whether it's peer support or troubleshooting with maybe some difficult problems that they're trying to help individuals that they're serving solve, but just to create that opportunity where they can come together without the entire multidisciplinary team and just breathe and support each other, and then also problem solve on how to be a more effective team. And that can be to support each other better, but that can also be going back to the multidisciplinary team and coming up with creative ways to provide ongoing
mhm.
training around the role of the peer and the role of the recovery model and the medical within the medical model.
How how do you mesh those two? I mean, it's different every place you go, but when you go into a medical environment, very highly clinical environment, particularly with these multidisciplinary teams that you're talking about, so you're going into truly medical environment, and then you're bringing in this recovery concept that maybe they've never even had before. What's that like? How does that feel to begin to bring those two together and then problem solve? And I would think, it's amazing to watch the change, but it's probably got lots of bumps in the road as you do it.
It's actually really exciting, and I feel so lucky to be a part of this. And I think that the organizations that are moving in this direction, there's a level of readiness that goes along with it. So we're not, and then we talked about the ongoing, the pre-training and how important
Right.
that is. Um, of course, there are some bumps in the road. There are those resistors to change that is difficult, but those are the folks that we need to um, try to get to know and try to get to know. I mean, I'm sure we have a lot to learn from them as well. And so trying to create a safe, shared learning environment is critical.
The
Yeah.
people that I think, Dawniell, you talked about this some too. Um, so the people that you hire for these positions, when you get a new contract and you're going to be putting peer support, you're hiring experienced people, right? And then you're doing a lot of the training too, it sounds like. Um, have you ever had an issue where when a peer's going into a clinical environment, and I don't know if you've had this experience. I know I have when I was first working, is that I would go into an environment to work and people would just kind of talk as if I wasn't there. And they would use all of the old terms, the way they referred to the people that they were providing services to. How do the peers deal with that? I mean, I assume it still happens. I haven't been in that situation in a while, but I assume it still happens for all of us sometime. And how do they deal with it? How do you prepare them to deal with that? Either one of you.
Dawniell, I'm happy to take it, but I wanted, did you have something you wanted to add to the last one or and take a stab at this first or?
Yeah, this kind of spans both the previous question and this one. And I do want to say that as an organization that, works with other agencies that are looking to, start peer support for the first time, one of the things that we've had to learn sometimes the hard way is that these organizations will come to us because they know that we're a peer organization. They know that we've been doing peer support for, decades, right? And so it seems like they respect our expertise, okay? On paper, it seems like they respect our expertise. But when we really get in there and we're like, okay, in order for this to work, based on our past experience, based on, the number of, the hundreds of peer employees and volunteers that we've hired over the years, these are the things that need to be in the place. These are the things that we need to do. Everybody needs to be on board. And they're like, yeah. Okay, we got it. And then we get in the situation, this has happened a few times, and sometimes we're able to kind of work through it, and other times we have to, really look at our options. We get in the situation, and the folks just really, they either didn't anticipate that the level of change that they would really need to engage in, or the difference, the different way of looking at things. They didn't, and maybe they didn't think that we really meant what we were talking about. Maybe thought that this was kind of just our dog and pony show. This is what we come out and say to everybody. Or maybe they thought that they were doing it, but they really just didn't have a frame of reference. And so I think what can be really hard sometimes, especially for the peer staff themselves, is when their organization either doesn't have the experience to navigate through some of those challenges with the funding organization or with the, where they're going to be co-located. Or if the organization just, is kind of in a dire situation, they need this contract. And so they're kind of willing to do whatever the funding organization, wants them to do, regardless of best practices, regardless of the evidence base for peer support and how people are supposed to actually be functioning in their roles. So I do want to say that, even though this is more of an organizational concern, it does affect the employees and it does affect their supervisors as well, because everybody needs to be on the same page and be willing to stand up for the same specific values and the same specific perspective, and not capitulate because they need this contract, or not capitulate because for whatever, or this is a really prestigious organization that we have an opportunity to work with. And so that can be hard. And I do want to acknowledge that as an organization, we've had to make some of those choices, and at least we're in a place now where we've had success. We've been able to build up, our organization, so we can say no to some of those opportunities that really don't fit. But I think it's hard because it's like, we're going into it in good faith. We're training up our peers. We're trying to let them know what to expect, but the other side isn't really doing their part. So that can be really difficult.
Yeah, I can imagine. When I think of all the experience that you guys have and that Cal Voices has, and I have forgotten every time to really explain who Cal Voices is. Cal Voices was 1946 you were founded. So you're the oldest peer-led advocacy organization in the state of California. I mean, that says a lot, I think. And the fact that you are peer-led and that you've approached this from that point of view, but at the same time, you're probably as organized or more organized than the people you're doing business with. So it's really amazing. This is what we need to really make change, I think. I think that the Mental Health America certainly has lots of affiliates that could learn from you. But I think also our audience, which are to a large degree, it's clinical personnel that are watching these. And so, you may find that some people will be reaching out to you for some advice, because I think you guys do this very, very well. We've talked a little bit about mentoring in our other discussions. Do you find mentoring from the clinical side, where people actually take some of the peers and really become true mentors for them? and bring them along so that it becomes a really, healthy relationship?
Dawniell, do you want to?
I can't really speak
I
to,
can't.
yeah.
I guess I'm struggling with that because I think that I don't think mentor is the right word.
Okay.
I think ally is the right word because we have allies within organizations. So, for example, I would say, I'm thinking about several of our programs right now, both on the outpatient, inpatient, and just systems advocacy level. I feel like we've had a lot of psychiatrists that have been huge allies. We've had one in particular said that he will never work in a program again that doesn't utilize peer providers because they are, so incredibly important to an individual's journey to recovery. And I feel that with our clinicians, caseworkers, there's been a kind of a tug of war, more so just in the programs that I've seen over the years, where it becomes more paternalistic, or just role confusion. Just so I think that it's been quite interesting. But I guess the way I would not use the term mentorship, but really be we have allies that where they want to work together for common good, and that's to help an individual recovery and live their best life.
What are when you hire your staff and you're preparing them to go to work in another environment, how do you work out the details like time off, the ability to take vacations, the other kinds of benefits that you might offer that perhaps the place that you're contracting with doesn't offer the same thing? Is that ever an issue for you? Saying that,
So I can speak from one of the programs that I oversee because they do have a different schedule than we do at Cal Voices. But I think that's part of the conversation when we go into this partnership and when we create a contract, is that we let them know in advance, that we have these are our paid holidays.
right.
This is how much time, this is our PTO, this is how much time individuals will have. And I think one of the things that I try to do with the program that I'm thinking of that's off, because most of the others are public mental health and we have the same holiday schedule, but in the private sector it's a little different. But one of the things we do is we really try to be mindful of staggering individuals' times off so that we can ensure that there's appropriate coverage,
Right.
and that everybody's not taking, a week off at the same time.
Yeah, I just want to kind of jump in too, because I think also from the contract perspective, if you define what the productivity is supposed to be, what the outcomes are supposed to be, if you have clear measurable deliverables or measurable productivity, then it's not so much of an issue if the folks in your program are meeting those output requirements, right? Because the agency with which we're contracting, they're not so much concerned that, someone's going on vacation or someone needs to take leave. It's more, are we meeting our contractual obligations? And if we're able to meet them, with fewer staff members, in some cases, they might even like that better, although we don't want to set that expectation always. But so I think it's really communicating with the organization that's funding us and that we're partnering with to get clarification around what those expectations are, and why presence isn't a proxy for productivity necessarily. Right. And we also happen to have a really generous PTO policy. So even if, we're following the same holiday schedules as some of the organizations with which we work, we still have a pretty generous PTO policy. And, we explain to some of our funders if there's any pushback or if they have any questions, it's like, this is one of the benefits of working with our organization. We're a peer-run organization. People need time, they need flexibility, and that's part of keeping them well. And they're not a county or a government employee where they can amass tons and tons and tons of time off. So
Right.
we try to be generous, and so that also there's not this feeling of I work in this county agency, and everybody I work with has been here for 15 years, and they get 6 weeks off a year, and I'm always here every single day. We want to kind of also create like some parity there as well.
When you're negotiating the contracts, how do you arrive at how many people a peer can serve, for instance, in a given amount of time? How many people can they have simultaneously that they're serving? I know you do a lot of different kinds of environments, so it's different for each one, but how do you actually go about making those decisions when you're negotiating?
Can I just say that I'm so glad you asked this question? This is so incredibly important. And I think that for, California we're unique in a lot of ways, but in one way that is an area for growth for us is in peer certification. I think most states already have a state recognized peer certification where it talks about the number of individuals on your case plan. Like, for example, who was I just talking with? The affiliate in Georgia, their peer certification, I think, is at 30 or 35 individuals. Is that pretty standard, Patrick, across the nation?
It really does vary because in some of these programs, and I know the work that they're doing because I've been working with them on this project, you've got the peers needing to travel great distances. And Atlanta happens to be a place that has incredibly bad traffic. And so you spend all this time in your car every day trying to go to people. So you're really limited how many people you can possibly see in a day. So, they're all unique, but it's like, how do you figure out, because the client's always going to want more, I think, and you're always going to want to make sure people have something that's achievable. And so,
well, as far as the question is client caseload, right? For the peers.
Yeah.
I really think that, it shouldn't exceed more than between 20 and 30.
Yeah.
However, I think one of our biggest mistakes is with one of our programs, and I have to oversee this one, so I'm saying it, I'm speaking from experience, that if it's so important to set that expectation up in front, because what happens is, our folks are getting up to 50, 55 individuals, which you're unable to provide meaningful peer support when your caseload gets that high.
Right.
You're basically putting out fires. I think, now that COVID, and we've been and I think one of our biggest strengths is being able to adapt during a pandemic, a global pandemic, because we have been able to, create a YouTube station, move all of our groups to Zoom or Teams. And I think, we've been able to continue, we've been able to buy notebooks and iPads for the clients so that they can have those telehealth appointments and set them up, and to be able to teach people how to use technology and how to stay connected with other supporters. So that's been really awesome, and it's allowed them to continue to do meaningful peer support even with those higher case numbers. However, once our world, hopefully sooner rather than later, starts to get back together and connecting when it's safe, 55 is just, it's way too many. It's just too much. So, and again, you're right. It depends on the program, but for programs that are outpatient, I would say no more than 30. 25 would be ideal.
Right. I mean, some of the places that peers go, for instance, I've worked on projects where we've put peers into state hospitals. So it's all inpatient. It's not a breakthrough program even. So there's no going back into the community. So there you can serve a lot of people. A big part of what you're doing is probably group anyway. And then, you're turning over that number of people. So it's different each time, but, most of the programs now that are happening in state hospitals are turning into that bridger model, so that at least some of the peer staff are able to follow the people back into the community. And now you're back
That's
into
awesome.
like, how many can you possibly see in a week, or a month?
Yeah.
And what kind of services can you possibly provide if your caseload is as high as 50 or 55? It's scary. Yeah,
With
I
the
always worry
Bridger
about
model,
this. Go ahead.
I was going to say with the Bridger model that you're talking about, first of all, that's awesome. That's incredibly meaningful to have a peer be able to follow somebody from inpatient to outpatient to stay with them. We've been doing a lot of focus groups around that, and this is for folks that are formally justice involved,
Mhm.
and how they would really appreciate peers staying with them longer, up to several years, just
Yeah.
until they're really ready to understand how to navigate the system, because it's changed so much since a lot of people have been incarcerated. But for the Bridger model that you're talking about, from the outpatient, I'm sorry, from the inpatient to the outpatient, what is there a defined number that's
No, and again, a lot of it comes to geography. I mean, for instance, I'm involved in a project right now where we're going to be working with the prison system. So we'll start working with people while they're incarcerated and then follow them into the community. But when people are released from prison, they scatter. They don't all live in one little community. If it's, maybe with a
right?
jail, it might be a little bit different. But so we haven't figured out how to do that one yet. We're still trying to figure it out, and probably we'll set it up so that different people have different regions or something like that. But
Right.
geography is such a big part of it. I mean, if you're in LA or you're in Atlanta and you've got this Chicago, this horrendous traffic, you can only go so many places in one day. And then, or if you're in a more rural environment or small town environment where you can cover the whole county, in a day, it's all different. It's all different.
Right.
It's amazing where we're seeing peers really come in to places they've never been before. I was just in a discussion. We did a webinar. Actually, it was a panel discussion just a couple of days ago on peer support and social justice. And we were talking a lot about, people being able to, the blockade to actually having a just system. I mean, there's so much about the mental health system. Again, it varies state to state, but there's so much about it that was just, it's built in to be unjust. That in many, many states, if there's a crisis call, it's responded to by law enforcement, probably with no mental health people anyway. Law enforcement has the ability to put a hold on the person, transport them to a crisis facility, generally in handcuffs in the back of a police car. So now you're traumatizing or re-traumatizing people. But then there's these other places where it's a beautiful model where it's responded to. Police may be involved, but they're in the background in case there's something. But it's responded to by a mental health professional who has the ability to enact a hold, but also a peer specialist. And the peer specialist is just there for the individual. They're there to be the navigator, the translator. This is what's going to happen. Don't be surprised when they say this to you. And it has made such a change. The one that I'm thinking of is in a fairly rural environment, and it just made all the difference in the world to go from purely law enforcement to that kind of model. And so it's actually cut down on the number of days people tend to be in a crisis unit because of it.
Yeah. Heck
And so it
yeah.
has these effects like right away.
Right.
Yeah, and so tell us some of the places, the environments where you are putting peers that are coming through your contracts.
So we're working with both the private sector and that's, I would say that's relatively new, because we have a long, rich history of working with the public mental health system.
Yeah.
And the contracts consist of, we have drop-in wellness centers that offer ongoing and a whole host of variety of different support groups, and offers meals to folks, ever was prior to COVID, and they do a lot of great work. They even have a clothing closet. We also have a consumer-run warm line, a consumer-run older adult program that really works to create, to really have companionship and support so that folks can stay in their own homes. And that they're having their mental health needs addressed. We have advocacy programs where we work with county behavioral health departments, leadership teams, and we're embedded within those administrative teams. We also have youth advocates, family advocates, and then peer providers, obviously. That's what we've been talking about for several days. We have peer providers working on the inpatient and outpatient, and with law enforcement as well, community support teams. And then Dawniell, am I forgetting any? I mean, they're just pretty much.
The only ones that I can think of is, some of our folks also who work in the children's system of care work with the juvenile justice, in their county, with child protective services in their county, with the education system in their county. And so there's a lot of crossover there, especially in the children's system. So yeah, across all ages,
Wow.
Yeah.
Yeah.
Families, primarily consumers, but, families, youth, older adults, all of that.
That's another webinar I'd like to do with you guys sometime, because that's a huge topic, and it is, so many people have struggled to figure out how to make that work. Let's talk a little bit about professional development opportunities for peers and career ladders. How that works when you're essentially contracting out the time to another place. So how do you build in a career ladder for people, for instance, when you're working with that essential model?
It's funny that you asked that, because I was just thinking, we have a monthly management team meeting, and one of the things that I think our executive director has always really been a champion of promoting within. We invest a lot of time and a lot of resources in educating individuals and skill building opportunities. So I think one of the things that we've done a really excellent job at is creating those career opportunities within Cal Voices. Dawniell, I'm sure that you would speak to this more eloquently than me, but I give us a 5-star review.
Yeah, I would agree, because it's all true. Well, I'm thinking about, I've been here for almost 9 years, and I'm kind of, I wasn't here obviously when the agency began 75 years ago. So I'm thinking about how it must have evolved over time. And I can imagine that, we started out as a community organization, just providing mutual support, and after a while, we started getting, county contracts in the Sacramento area to provide self-help peer support programs. And so at that point, we had all volunteers and line staff, and plus, the executive director and our board of directors. So it was probably a very flat organization. But over time, as our programs grew, we had to build in other positions, like lead positions, supervisory positions, management positions. And because we've always been a peer-run organization, we've always hired people with lived experience, whatever the population they're working with, they have to have that same lived experience.
Right.
As our organization grew, the opportunities for professional development, exposure to new skill building, all of that, and new career options started to grow as well. Because now, everybody, except for like maybe 2 of our administrative staff, has lived experience in our organization, right? Most of them have, lived experience as consumers, the remainder as family members, or sometimes both.
Right.
And so okay, we have a program director, we have advocates, we have administrative staff who do like our communications, who do, our policy analysis and all of that, but all of them have lived experience as a client or a family member. And so as our organization does better and better, we're able to build those opportunities into our programs. And as we're able to establish a track record of success, when we have opportunities with new funders, then we can emphasize the importance of building in supervisory and management positions, and career opportunities into the contracts themselves. Because a lot of times we still encounter folks say, oh, peers are so great, and we'll build a career ladder because some of them might want to be clinicians one day. And we're like,
Right.
some of them might.
Right.
And some of them
I'm so
might
glad
not.
you brought this up. I'm so glad you brought this up, Dawniell, because I think that's something that we could do a whole presentation on, Patrick, because that is like, that's a, thank you, Dawniell, because not everybody wants to do that. And we have some of our peers actually that were originally clinicians, and they thought, you know what, I just really prefer providing these peer support services.
I'm seeing more and more of that. But go ahead, Dawniell.
Yeah.
Yeah,
Yeah,
no,
sorry, Dawniell.
No, that was pretty much the gist of it. I just think that, laying down little by little, building up that track record of success, we were able to build out other positions and then make the case for having a career ladder within each program as well. And then, we're able to push back when we do hear that, and when they're like, oh yeah, why do we need to build in these positions? Because, they can only go so far as a peer. And we're like, well, look at our whole entire organization. Everybody here is a peer, right? You don't just have to be a volunteer working 10 hours a week or whatever, answering the phone at the wellness center or something like that. Like, you have this whole variety of options that are available to you, because it takes a lot of different things to make this organization run. And what we don't have working here is a clinician. We still have 75 staff. Right. We don't have any clinical staff working with us. And we're happy to work with clinical staff. That's necessary for a lot of folks, but just because, they were a peer, it doesn't mean that that's their only career trajectory. So, it's important to emphasize that sometimes, because I don't think people see that, because I agree, Patrick, there's just not a lot of models for successful long-term peer-run organizations out there. So we're kind of a unicorn.
So what might be a path for somebody who comes to you? Their first job is they're a peer specialist, and now they're going to work in a maybe one-to-one or running groups or something that's really kind of the baseline for being peer support. And then what might be a path that they can follow to continue to, build their career? Somebody?
I think
Dawniell,
Andrea,
did you want me to take it? I'm sorry.
I'm just laughing because that's your career with us, really. Like,
I muted myself because I got all excited when you were talking. I didn't want to interrupt again, because it was so important. It is something that comes up so much. So somebody that wants to get involved, I can talk about, it is my experience, because when I first started within this organization, I started off as a volunteer. And what's interesting is I was attending a support group for individuals with depression and bipolar, when the support group facilitator, who was an older adult, took me under her wing and said, hey, you have got to go to this organization where I work and volunteer. That's where it all started for me. And it was through attending a peer support, getting turned on to a peer run organization. It was huge, incredibly important part of my personal recovery journey. And from there, there's been so many milestones. But for an individual just starting, and I get this a lot, like, oh, I have lived experience, I want to be a peer provider. I think that's wonderful, but there are steps that folks need to take prior to being a provider, because you are working, you're providing, an incredibly important, role, but you also need a little training and experience first. So I would never just throw somebody into a multidisciplinary team that's never been through WISE, or at least that's something we offer to all of our employees, or been through some sort of a peer certification training. But then also I want to see individuals that have actually put in the work. I want folks that have been attending peer support groups, facilitating peer support groups, volunteering at peer-run organizations. All of that is so incredibly, that hands-on experience is critical prior to just having somebody. Now, if somebody comes to us with all of that experience, then again, we're excited because
Right.
again, in California, we don't have that state recognized peer certification. So we've had to put a lot of extra time and effort in just to get people caught up so that they're ready to provide these services.
So just give a brief explanation what WISE is again for people who weren't in our earlier one.
Yeah. So our WISE program here at Cal Voices, WISE stands for Workforce Integration Support and Education. It was a program that we started back in 2015 that originally provided training and technical assistance to employers of peer support workers, and then to employed peer support workers themselves. And then we expanded that program to we call it WISE U now, our WISE University. It's a 77-hour intensive foundational peer support training program, and we also place folks in peer positions. Often, whether they're volunteering positions, whether they're paid peer positions, we support them in developing career plans and all of that. So all of our own employees go through our WISE training. They go through WISE U within the first 2 months of starting here, but we also train peers throughout the state. And especially it's been easier now because of the pandemic, they're able to attend online. And so we train them, we place them, we help them with career plans. And so when Andrea is saying, if somebody who applies to us or is coming to us looking for employment has already been through WISE, that's a good funnel for us to identify individuals who, when we have open positions, to kind of pull from. So, yeah.
There's so many questions I'd love to ask about all of this. It takes me in so many directions, but I want to talk a little bit about, okay, so we've got people, we've prepared the environment, we've prepared the peers to enter into that environment, we've got the whole structure set up with supervision and the opportunities that people have, and now they're there, and now they go to work first day, and they start to provide services. What are some of the typical things that might come up, that problems or barriers that need to be solved, and then what's your system for doing that?
Communication. I mean, the
Yeah.
problems and barriers. I mean, I think it's communication is key, and it's really important that to us that our employees know that they have a point person, they have somebody that they can call, that they have a second in line if that person's unavailable. Here's who you can contact, but that also that our leadership is making a concerted effort to reach out and to provide, ongoing support, coaching, check-ins. So that, a lot of these things that come up, these problems and issues can, usually they're simple fixes, but we need to just ensure that we're having that open communication and dialogue so that they don't escalate into something bigger. And
Yeah, just to go back over something we've discussed in the previous discussion, was that the way you have it set up is that the peers who go in to provide these services, they also go in with someone who is their supervisor that works for Cal Voices, and then they become the front person to make sure that everything goes smoothly. So the individual doesn't have to solve the problems on their own.
absolutely not.
Yeah.
But we encourage people to, and I
Yeah.
think that's one of the most, we encourage people to, if there's, we want folks to have the confidence and to know that it's okay to advocate for yourself and to have your needs met. But if it's, there are those political or more
Sure.
difficult situations, they always know that we're happy to help navigate those waters.
Yeah, I think this is one of the areas where a lot of groups contracting out peer support services have not succeeded because they don't have those layers of, that the supervision is provided by the actual employer, other than maybe administrative supervision. And so they're just kind of cast adrift into this wasteland, basically, of a clinical world that they're not familiar with, and they're not feeling like maybe they're a real part of, and they don't have that
And
person to translate for them.
right. And that's so concerning because I'm seeing a definite shift and a definite interest into um, agencies and counties and states wanting to move more into the direction of increasing their peer workforce
Yeah,
without having a solid infrastructure in place. And
yeah,
it concerns me because I know that we have seen those issues arise in just the counties throughout California that WISE has been supporting over the years. You know, we've been so fortunate in Sacramento because we've been doing this work long before WISE came. I mean, WISE came about because of all the work that we've been doing for so long and before MHSA, which folks may not be familiar with it if they're not from California, but this bill that passed in '04 that really created a more community-based recovery
mm,
model. We'd been doing this, for many, many years before. And so I think that but since then we've been able to go and help other counties kind of start to develop what we've created here. And we've seen that when you don't start off by ensuring that you have adequate training and support for peer providers, or you're just hiring one
right,
peer provider, you actually do more harm. And then you also run the risk of creating well, obviously poor outcomes, but then having other team members not wanting to embrace this moving forward to try to, it's just always harder to go back and try to fix something than
yeah.
just do it right the first time, I
You
guess.
know, I've seen so many states where peer support goes down for a while because they don't, what they try to do is they think, well, we want peer support in our program, so we're going to just hire some peers to come in with no structure in place to begin with. And they really don't know exactly what it is that they're going to do. The programs generally don't go through a design to accommodate the use of peer support. And so what has happened in a number of states is that because there's this disappointment that it didn't work out the way they thought it was going to work out, that there becomes a hesitancy to hire more peers. And so there's this lag. We had so much of that in the early 2000s with states where they first, certifications started building really rapidly around 2004, 2005, states taking on certification. Everybody thought, okay, that solves everything. We're just going to hire a bunch of peers. And
Right.
then, and then by the end of the 2000s, a lot of places didn't have any peer support. So now I think the model that you guys use is really the dominant model. It's being done in different ways. For instance, in many states where there's managed care for Medicaid services, the managed care organizations end up being, they either contract with a peer-run organization to get the people they need, or they hire peer leaders, peer trainers, peer supervisors, and build a whole internal system. And they've done it, the ones who've done it that way. Um, Optum was a good example of this. Optum was, hired the woman who was the former head of DBSA, and then next time they hired the next head of DBSA. So they built up a system, and it worked pretty well for a while until the policy changed and things like that. But meanwhile, some of the managed care companies didn't know how to do it at all, and they just thought, well, we'll hire 5 peers and put them to work, and everybody will have access to them. And then they're very disappointed, and it gets written out of the contract. So the ones who have done the best are the ones I think that have contracted with peer-run organizations, just like you guys do it. So, well, I think we are done for today. And I think we have one more interview that we're going to do together. And I really enjoyed this. And I think this information is incredibly important because the people that this program, SMI Advisors, speaks to, it's a wide range. It's a range of clinicians, but also administrators in my classes. For instance, in this class, I have a couple of people that are either state or county administrators who want to see peer support come into their area. And there's others that are large provider agencies wanting the same kind of thing. And then we also have a lot of peers that join into these classes. And generally it's because they want to see it done better than what they're experiencing.
Good.
So,
That's awesome.
yeah, it is. And this is such an exciting thing to see the change. One of you mentioned,
I should be interviewing you though, Patrick. I mean, honestly though, I should be interviewing you because every time I talk to you, I wish I was recording our conversation because you're just
well, this
a
is
wealth
recorded,
of
so there we go.
information.
One of you mentioned, I think it was you, Andrea, that maybe it was a thing for another discussion, but clinicians who then want to become peer support people. And I've met a number of people like that.
Yeah.
And it comes from different places. A lot of it comes from, peers who, I mean, let's face it, most people who work in community mental health or public mental health have a real reason to do it. It's not because they get paid a whole lot of money.
Right.
It's because there's some attachment, either their own, attachment or family or friends or something that's driven them in that direction. So we do see an increasing number of people who maybe have been working, maybe they were in case management, or maybe they were a therapist. I've recently been working with a woman who's a pharmacist and teaches pharmacology at a small college. And she just got her peer support certification. And to her, that's
awesome.
the most valuable credential. So
that's awesome.
It is awesome, and it's exciting, and it's just going to grow. So thank you again, and have a nice evening, and take care.
Thanks,
Thank you, Patrick.
Bye-bye.
Bye.